exactly. So with that, we'll get rolling here. Welcome everybody, and thanks for joining. I'm gonna start moving forward. By way of introductions, my name is Alan Bucknam. I'm a founding team member for Sync Times. I've been working at Sync Times for the better part of the last 6 years, and we've been really grateful and excited to be joined today by Hannah Cook. Hannah is a manager of clinical quality and performance improvement at Kinixu Community Health. She'll share a little bit more about herself and Kinixu. Let's see, Hannah, I want to double check we've got you here. I know I saw you on the chat a second ago.
Yes, I am here. Hello.
Oh, good. I was, if you guys were just going to be hearing from me, this was going to be an awkward webinar. So great. Well, Hannah, I'd love to, if you don't mind just introducing yourself, that would be great.
Yeah, so like Alan said, my name is Hannah, and I work here at Kinixu Community Health as a manager of clinical quality and performance improvement. I've been with Kinixu for just shy of 10 years. I get to celebrate my 10th anniversary in August, so very exciting for me. I started out as a dental assistant here and progressed to a management position in dental. And then an opportunity came my way to join the quality department and kind of took a leap of faith and have really enjoyed my time here on the quality team for just a little over a year now. They've never had any dental perspective on the quality team before, so to be able to utilize my expertise in our dental department to now our quality department, it's been really exciting.
Yeah, awesome. Hannah, also, when we were out at Kinixu last time, or maybe it was the time before last, shared that one of the important things about being in Sandpoint, Idaho, is you get your own place to pick huckleberries. And Hannah will not be sharing that. That's top secret, I believe. Is that right, Hannah? Are you going to share that today?
It's true. I, honest to goodness, don't even have a place because nobody will share with me where to go.
Oh, really?
So.
You're on your own, huh?
It is sacred. Everybody that lives up this way knows what a huckleberry is, and it's a sacred thing for people of Sandpoint.
We asked a couple people to share their place, and we were met with fierce responses, and the answer was no. There was no sharing that was going to happen there.
Very true. Very true.
Awesome. Well, before we jump in, we just want to highlight this webinar is part of an ongoing series that we call our Illuminate series. And the idea here is that between webinars and other educational opportunities, we have events where we're hoping to help health centers share best practices and share operational information and knowledge with each other. That kind of culminates every year in what we call our Illuminate Summit. That happens here at near our headquarters in beautiful Provo, Utah. You can see the mountains behind me here. So it's usually a great time of year. Usually the leaves are changing, and it's an awesome experience. Hannah had the chance to join us for the first time last year, so I was gonna just give Hannah a chance to kind of share her experience during that.
Yeah. It was great. It was wonderful to go to Utah and see Provo and, meet all the team members of Sync Time in person. For me, especially knowing that there was going to be a guest speaker that was attending, Jonathan from CBHA. He was presenting on Sync Times and how they've utilized it in their dental clinic. And at the time, we had just launched our OHI project, which you'll be hearing more about today. And so it was perfect timing to hear more information about how it works in dental. But it was a great opportunity to network with people. Oftentimes, in going to conferences, we kind of stay in the state of Idaho and work with those partners here in our state. But the opportunity to meet other folks in different states and what they're doing in their health centers. And like I mentioned, really hearing more about how we can utilize it in our dental department was huge. It was great.
Yeah, awesome. Well, I'm not gonna take too much time here because Hannah is the star of the show, but I'm gonna just share a quick background on Sync Times, what it is. So Sync Times, we provide really 3 services through technology. The first is we help teams to locate, so know where their teams are throughout the clinic. Second is communicate, so being able to quickly communicate tasks for patients to other members of the team. And then third, illuminate, and that's really taking data and being able to deep dive into what is happening in the facility. The locate component is driven by a wearable device we call a beacon. And so that locates where staff are throughout the facility. That's also accessible through flow stations. So on television displays, you can see a view of what's going on throughout the entire clinic. And then there's tablets that are at the exam rooms and operatories. And from those tablets, you can communicate different tasks. So if you need somebody, the specific use case we'll be talking about today is if you need somebody to come in for an OHI or an oral health visit, then you can select an icon and that can notify them both on the TVs as well as on a smartwatch or on a text message or their computer. They can pull up that flow station view on their computer or on a cell phone to see what's going on throughout the clinic. So it's just a little context on what sync times is. We won't spend any too much time digging in on that because we want to turn the microphone to the star of the show here, which is Hannah. Hannah's going to share a little bit about Connexu, and then we're just going to have a conversation about some of the workflows and some of the innovation that they've been able to adopt there. When I was first introduced to Connexu, I kind of had been through that area. I grew up near the area that Connexu is in Eastern Washington. And I just thought, oh, this has got to be just a tiny health center. I don't know if, how much innovation there can be up there, but, we'll give it a go. And I've been just super impressed with what Connexu has done. They aren't a huge health center, but they do punch way above their weight in terms of innovation and in thinking of ways to deliver great patient care for their patients. So with that being said, we'll turn the time over to Hannah and let you introduce Connexu, and then we'll have some conversation.
Perfect. Yeah. Like Alan mentioned, oftentimes people ask you, what's your favorite vacation spot or where do you like to go? And I love staying home because we're really fortunate to have all 4 seasons, and Sandpoint offers really amazing things. And I've been fortunate enough to be with Connexu for as long as I have. So to see the growth has been amazing in my time here. Connexu was first opened in 2002. At that time, we had 1 location in our Bonners Ferry area, which is in Boundary County. And at that time, we only offered primary care. We then were in a position to then offer dental and behavioral health. And then in 2011, we opened 2 additional locations, one in Pend Oreille, which was about 30 minutes south of Bonners Ferry, and then another clinic in our Priest River area, which is about 30 minutes west of Pend Oreille. Had great, opportunities to have patients come in and establish care in all 3 locations, which was awesome to be able to, spread out our services. In 2015, we took on our Sandpoint Pediatrics Clinic, which was really great to be able to serve the pediatric population in our community under Connexu. And then in 2021, we built our Sandpoint location, which is featured here on this slide. That's our newest addition to Connexu. And in 2022, we opened. It was amazing to then have everybody under one roof to offer family medicine, dental, behavioral health. In 2022, we also opened up a pharmacy. We opened up a daycare for our staff. So lots of really amazing growth for Connexu, and opening up that location that offered just co-locating departments, which has been amazing and truly a contributor to why we're able to do what we did successfully with OHI.
Yeah, you guys did a great job with this facility. Hannah, you'll be so proud. I don't think I told you this. I took this picture, so this was a sunset.
That's stellar.
Yeah, pretty good, right?
I
was
not bad.
Pat myself on the back there.
You should. It's a good one.
One of the I wanted to share when we were working on implementing the Connexu's first implementation of sync times was in this new facility. And when we were working on that implementation, looking at the floor plans, Amber, the COO at Connexu, shared, we have the pediatric department for medical services. And then right next to it, we have dental. We have this door in the back. And that's because we want to provide some shared services. And that was something I hadn't seen before. And so I just nodded and smiled and said, okay, that sounds like a great idea. And so today's conversation is kind of fun to reflect on where that's been able to come since then.
Absolutely. Yep. So yeah, this timeline here just kind of shows, like Alan was just mentioning, we went live in January 2022 on opening day with Sync Times. And at that time, it just was offered in our pediatric department and our family practice department. Implemented the new workflow for dental with the OHI project, which was in June. I don't know if I said June, I might have said January twice, I apologize. And then, like I said earlier, we got to go down to the summit in October and really kind of explore what more we could utilize. Then we just decided, yep, it's worth it. It holds a lot of value. Let's get it outfitted in our dental department. And we did that in March, and then just released our I2I integration as well. So lots of projects happening for us here at Connexu with Sync Times, but it has been so exciting, and I look forward to seeing what next month and year we can put on the timeline for the new things we want to come up with and do. Perfect. So this is a really great visual for us and for you as well. You know, I'm sure that, like many other community health centers, you know, experiencing high no-show rates is pretty common. And we wanted to take advantage of how we could utilize that high no-show rate that we were experiencing. And because we had just had an opportunity to be co-located with our Sandpoint department, our Sandpoint pediatrics department, in our dental department, this was a great opportunity to really merge the two together and create a collaborative project, being under the same roof, and to help kind of that no-show rate. We had seen, you know, a lot of opportunity for access at this point with our hygiene team. And like I had mentioned, you know, we primarily work under a model that serves our pediatric community. 66% of our pediatric dental population is on Medicaid, and we are the only dental office for 2 counties that currently accepts Medicaid. So we work in that model, and we wanted to make sure that we were catching all these kiddos that were coming in the door in their well child visits, and, you know, introducing them to dental. So
Yeah, I love this graphic. I think a lot of our health centers, you know, obviously no shows from a financial and an operational perspective can be challenging and frustrating. I think this, what this does also ties it back to the mission, right? You know, 37 slots where we had people available to help take care of patients, and we weren't able to deliver care for patients during those times. I think that's a great message.
yeah, absolutely. Absolutely. So yeah, the goals and the integration. So I'll just kind of go off some bullet points here, but also add additional feedback too. Just creating that awareness for our new co-located pediatric department. Prior to this clinic, we were in 2 separate locations. There was a lot of intentions, like Alan had mentioned, placing pediatrics and dental next to each other. We had tried things in the past, but it was so difficult to deliver on it when we were in separate locations. You know, it's one thing, and it's easy to say, hey, if you just drive up the road 10 minutes to our dental clinic, they'll get you in for a fluoride treatment. Well, now you have a mom of 3 kids, and this one's losing it, and this one had an accident, and that trip to dental is now not happening because life happens, right? But to be able to offer that awareness that you can come to your well child check or any appointment within Connexu and know that there's another department that can also serve you. Increasing that smart scheduling as well was so important for us. You know, we realized how people are just busy, that our lives are all busy, and being able to offer back-to-back appointments. We were rural, and so sometimes our patients are driving an hour plus to be able to come for these appointments. So to be able to offer, you know, back-to-back appointments, especially with these well child checks and this OHI visit, or even a dental exam in that same day, is huge for the patient's experience. And again, referring new patients, new pediatric patients to our dental department and making sure that they're taken care of and that they know that we're here to serve them. Yeah, detecting early problems, you know, this is huge. It's prominent in children where early childhood caries are high, and, you know, being able to kind of intervene and let them know, you know, these are the things that are going on, and these are the ways in which we can help you. And being able to provide that information to them was just, it was crucial. Also kind of reducing that preconceived fear of the dentist. Oftentimes adults have a bad experience as a child, and in turn, it creates barriers for them to receiving their care, and then their children hear that kind of preconceived fear, and to kind of break down those walls and those barriers and actually give it a brighter light as to what it is. Being able to do that for the kids in our community is huge. And again, the no-show rate for our hygiene schedules was a big driving force behind this. And in a next slide, I think you'll see kind of where our access percentage was, and then where it is now. It's made a huge difference and has made a huge impact on that no-show rate. Here's our little icon on sync times for OHI. This is the icon that gets pressed when a child is in a well child check visit and alerts our hygiene team to come over and see these patients. You can see there that over an 11-month period, it was pressed 1,305 times, and I'm sure that number has gone up as it does daily. Oftentimes you'll have a patient that's scheduled and mom or dad bring in their siblings into this appointment. So while the icon might only be pressed once for that patient's appointment, you're also potentially offering OHI and a fluoride treatment to 3 additional patients that just so happen to be in that room. So the amount of times it's been pressed doesn't truly reflect how many we've been able to do. And like I mentioned there below, we don't have sync times right now in our Bonners Ferry location where we do have a dental department, but we wanted to make sure that we could offer OHI in another clinic that had dental. And so we came up with a system that we felt would work really well. And so we just have a walkie-talkie back in our peds department there. We have 1 pediatric provider up there, and another in our dental department, and they just kind of call over the walkie-talkie and say, hey, we have a patient here that's eligible for an OHI, and if you can come on over, then head on over. And it's been very successful there. I look forward to when and if we do get sync times in our Bonners Ferry location, and how useful it will be all the way around, but especially for this project. I think it will be really cool to be able to capture the data behind it as well.
Hannah, would you mind sharing just a little more kind of on the ground? So let's just say that you have a well child appointment in peds. What is the conversation, and how do you go from a patient just showing up for their appointment and deciding, yes, we're going to have OHI, and then how do they get notified? How do they show up?
Yeah.
What do they bring to that visit? What do they talk about? Maybe just go through that
Certainly.
whole, what the experience
Kind of
is for those
workflow.
patients.
Yeah, absolutely. So we felt it was beneficial to really kind of dial in our verbiage around it and not necessarily offer it, but to let them know that this is just a part of their well child check. I think that was a big game changer for us. We wanted our patients to know that when you come here and you have a well child check, this is just part of it. In the early stages, we were trying to determine, is it before the provider comes in? Is it after the provider comes in? Trying to figure out when the best time would be. And a lot of our team decided that, after the MA comes in and checks in that patient and does their intake, the MA presses that icon. Fortunately for us, all of our hygienists wear an Apple Watch and have the settings to notify them on their watch. And prior to having it in dental, this was a great means of communicating, because they weren't always at their computer in their exam room at the time. So when that's pressed, they go over there and they bring a little caddy that basically has a toothbrush and toothpaste, their fluoride varnish application, and some additional, education pieces on fluoride. Oftentimes they'll get asked, questions and want to make an informed decision on what they're doing, which is totally appropriate. One of our hygienists had built out a Q&A, utilizing resources that they could make an informed decision. And even though it might not be something that they did in that appointment, when they came back and felt like, okay, this is going to be good for my child, let's go ahead and do it. We want to make sure that they're feeling as comfortable and confident in what we can offer. These visits with the hygienist truly are about 5 minutes. We've been able to really narrow it down. We're now starting to see that kind of recall of patients, which has been very exciting for that team. to have patients come in and kind of tell their story about, when you came in here and you told me these things and I got a new toothbrush, and at the time I wasn't good at brushing my teeth, and, having you come in here and check in on me and letting me know I've been so successful at brushing my teeth, and the parents in the background like nodding like, yes, this has been so wonderful. We've even got it down to where our hygiene team is just so pleased with this, and being able to break up that monotony of clinical hygiene that they do, to where they basically alternate days. They all get alerts, when there's an OHI being called, but each hygienist on the day that they work will typically have their template kind of blocked out specifically for OHI. So they know that they're going to be available to respond in that moment, not while interrupting, a patient who's receiving a cleaning that day. So we've been able to kind of fine tune it for us, and it's been very successful, and the workflow is very dialed in. And in the moments where they have the additional time to spend with the patient, they will. There's no doubt, they want to make sure that they're answering all the questions that are being asked as best as possible. This is an opportunity for these patients and the parents to also ask questions about another family member that might be, having issues with a dental related issue, and just say, hey, this or that, and being able to offer them that feedback or direction or guidance. It's been really phenomenal for that team and the patients.
Yeah. I think one of the just a couple of thoughts I wanted to share. One of them is when we went had our first son. I remember we were at his pediatric appointment, and his medical provider said, okay, and dental care is important, and it was early, and it was like, oh yeah, even if it's just gums today, we need to start thinking about providing him dental care. But then that was kind of it, and it was kind of like, okay, now we're just trusting mom and dad to remember. And then, as soon as we get out the door, he has a blowout diaper, and, we have to run to the store, and just all the things that happen in life and as a parent, right? And so I think what's really cool about this to me is the same thing that we, I think, experience, and the reason that, behavioral health integration is so valuable is that you can, as a medical provider, you can educate on all the services that are available. And at this point, that list is getting pretty long, right? Or you can just actually have it happen immediately. And that's what's so cool about this. We pulled, I just had Ian while we were on, pull some times just to give for context. So on the tablets, when the medical staff select this icon, on average, that icon is up for about 3 minutes before one of the members of the dental hygiene team responds to it. So within 3 minutes, they have a response. And on average, the hygienists are spending 6.1 minutes, so about 6 minutes and 10 seconds, give or take, with the pediatric patients. So it's really not a huge, not a huge intervention when you think about what we see on average, especially when we first start with health centers, is that their patients are alone for about 20 minutes in the exam room without any interaction with staff. So I think what you guys have seen and effectively done is, okay, let's take that wasted time and provide a value-added service that really is going to drive improved care for the patients.
Yeah, that was a huge contributor too, is, just realizing that patient's experience and what that wait time is. And now, having sync times, having that awareness of how long a patient is actually sitting and how do we utilize that time to be valuable. And, the patient's experience is so important to us. And so to be able to kind of, mitigate that wait time and offer something that's educational and, just give that patient what they deserve, and that is the attention and the things that we can offer during that time.
Yeah, awesome. I'll jump forward a little bit to data here. I know there's probably someone on the line that's thinking, okay, just give me the numbers. I want to see the numbers.
Give me the numbers. Yeah. So for us, we still go through and offer the OHI, which is just the education if a patient and parent decline the fluoride. And there's so much value to that too. Of course, being able to get a billable encounter on top of that is even better. But you can see there, and again, this number changes often. It's hard to keep up as it gets as these patients are seen daily. But 795 patients seen for a non-billable OHI, which is this just the education piece from the day we launched the beginning in June until the 5th of May. 749 patients seen for OHI with a billable dental fluoride treatment with that same range there. And from this, we have seen 31 new established dental patients in that same time frame, and that's truly a direct impact just from OHI. And like I had mentioned before, with Kinixu being the only community health center that offers dental patients, pediatric specific, that takes Medicaid, we are seeing a lot of those kids already within our community. And so to be able to get new established dental patients from this project has been so amazing. To get them to have a dental home has been great.
Yeah, that's awesome. I want to give a couple of just contextual questions to make sure, because every state does billing differently on this front. So my understanding here, Hannah, is that providing the education is not a billable event under your Idaho rules, right? But if you do fluoride treatment, that is billable, correct?
Yes.
Okay. And then that's billable just as an encounter, as an FQHC encounter.
Yep, so that is correct. So not only are we able to achieve a billable encounter with a well child check, but an additional billable encounter with dental just within the state of Idaho.
Yeah, and Lauren just posted on the Q&A that in Washington State there's a billable OHI code. If I remember right, it might be the opposite in Washington. And Lauren, you can just feel more than thrilled to correct me here. I think it might be that education is billable in Washington State, but the fluoride treatment is not, at least billable through Medicaid. Feel free to correct that. The other thing that does differ state by state is that some states will not allow for 2 billable encounters in the same day. Idaho does not have that rule. And so these are, in addition to the medical visit, and correct me if I'm wrong, Hannah, my understanding is in addition to the medical encounter, there's a separate billable dental encounter, and both are happening in that same exam room for that patient.
Correct, yes.
Awesome. Just one other thing, I had Ian pull real quick. What percentage of pediatric visits in the last 12 months this icon has been used for? And so to give an idea, in over the last 12 months, the icon in Sandpoint Pediatrics to say we need OHI has been used for about 13%, 12.7% of visits. So just under 13% of the patients who have come in for a pediatric well child visit have had this icon and have had education used. So just to give an idea for kind of what that 1,500, how that plays into the total.
Awesome.
And looks like Lauren.
That data, Ian.
Yeah, I'm keeping Ian on his toes here. We didn't put Ian on the camera, so we might as well make him pull some data for us, right?
Yeah, there you go. There you go. Well, very good. Our happy little kids here with the happy tooth. Just a little bit, we kind of sat down and talked about, what that projection might look like for additional new established dental patients and the revenue that could bring in. The potential is there. And again, with being the only community health center and having a dental department that takes pediatric patients that accepts Medicaid, we are seeing and serving a lot of these patients already. But as everybody's experienced, a lot of new influx of people moving into the area and, being able to capture those people that are newly getting established for, medical care, trying to, also let them know that we have a dental department here and we can offer that to you too. Going kind of back to, our access, you can see there that before this project, we were seeing a significant decrease in our access from our hygiene department. We were at 63% before we implemented OHI, and now we're averaging a steady 100% weekly with this project, which has been so cool. And I mean, even going further than 100%. So this has certainly brought in a lot of value for, the organization, for the patients, for this hygiene team. it's been really neat to see the progression, and it's steady, which is awesome. And again, just creating those long lasting habits early on in a child's life is so important. And so being able to, again, just kind of redirect that narrative that a lot of people are under the impression of, or those fears that were there from an adult that now kind of bleed into their children, being able to just kind of mitigate that and say, hold on a second, we can offer something so great here, and let me give you the tools and resources to understand it better. And that's super important to us, and especially with our pediatric population.
Yeah, that's great. I think if I were to summarize kind of what the maybe financial ROI is, I'm probably more qualified to talk to that than the clinical ROI, although that is significant. I think there's kind of three areas. The first one's highlighted here, which is bringing in new established dental patients. And so that's kind of item one that can bring in some additional revenue. Item two, which is the second bullet here, is just filling the schedules for the hygienists. So making sure that we're actually, when we're in the clinic, that we don't have those 37 no-shows that are driving down our utilization of our teams. And then the third one is just going back to here. It's this, you have billable encounters that are happening that wouldn't have happened otherwise. So those are all those are pretty significant kind of three buckets where there's a return on investment happening. And that's all leaving the clinical outcomes aside, and which are significant as well, just from getting children into these visits sooner. They're very quick to go in for their medical well-child visits,
Yeah.
maybe a little more reluctant to get in to get their teeth checked out.
Yeah, absolutely.
Awesome.
Absolutely.
I want to give you some chance to talk up the team a little bit here. So I think Hannah's
Yes.
pretty proud of the Kinixu team, and we'll let you
Yes.
up them.
Yeah. No, that, like I said, it's been great. I mean, there's so many components to this project too. You have your hygiene team that's coming in and performing the OHI, but you have your medical provider and your MA on that team also being a part of this. And Rebecca Resso, our lead hygienist, she was really the driving force from the dental hygiene team. And this is just something that she's so passionate about and has just, flourished in being able to offer OHI and coming up with new ideas, and being able to do something, like I said, that's just a little bit outside of that clinical hygiene, but still coming from a place of knowledge and experience, but just offering in a different capacity. Justine Fanning, she was our piloting MA. She was one that we went to because we knew that the buy-in from her would be there within a heartbeat, and it was. And working with our hygiene team and the quality team, finding out where those barriers were, how we could take them away, just dialing in our workflow. And, obviously you can read her testimony more in depth. I mean, she is just truly passionate about what we do from Kinixu as a whole, but, truly what we can offer our patients, and, just helping each other and creating change. And it's been really cool to see her kind of be the piloting MA on this and just loving it. It's been really cool. Tammy Ndiemi is a new to the practice, like she mentions there, but to be able for her to see this kind of integration piece with dental has been stellar for her. She's not coming from a place where it was done prior, and she's been really enjoying it and her workflow, and just that kind of whole encompassing opportunity for these patients when they're here in our clinic.
Yeah, that's awesome. Well, thank you, Hannah. This is super beneficial, and we've had some great feedback on the chat already. I know there's some other questions that people have. We had one that came through already, just related to scheduling. So how do you schedule staff? How do you schedule specifically tied to this OHI to be available when someone from medical requests education using the icon? What's the scheduling
Yeah, so oftentimes beforehand, we have created a report in I2I that kind of identifies well child checks that are coming in that day. So the hygienist team looks ahead of the time to kind of see where they can fit in these OHI patients. And like Alan had mentioned, that the time commitment to it is very minimal. So we don't schedule anything on the dental template. That is done thereafter. But we just have our hygienist team ready and available, and they communicate really well to see who's available and who can respond in between patients. And then, like I had mentioned before, we were in a place to be able to not quite shut a template down, but be able to schedule it lightly with your routine patients for their cleanings, but also allow that time in between where, you know, they would be able to respond to 8 OHIs in a 2-hour time frame. So you just kind of have to play with it a little bit and see what works best for you guys. But between using the I2I report to identify the well child checks that are coming in that day, having the availability on the hygienist template, and then just really dialing in your process to make this appointment very dialed in has helped us tremendously.
Awesome. Another question I think there's kind of clear how this would be beneficial and how the hygiene team would really see this and be like, yeah, you know, that is something we can do that we'd be excited about. What was the process and how did you get your medical team on board with saying, okay, OHI is a priority from a clinical perspective, from a mission-driven perspective? How did you get them on board enough to say, okay, I'm going to dedicate some time of my, you know, of my day, of my exam rooms, of my patients in to see me, to spend some time with a representative from the dental team?
Yeah. We certainly started out with those providers that would be a little bit more willing to kind of change their workflow or be more open to it. But again, we were really targeting that wait time. So there wasn't really a lot of room for taking away time from the provider. That was most important. We're utilizing time where the provider wasn't in there to begin with. And so that really helped. And once we were able to see, you know, that feedback from the patient and what they were experiencing from their perspective and the provider hearing it, and then it's like, okay, let's launch to the next one and, you know, bring it in a part of their workflow and really going into it saying, we have no intentions of taking away your time. We're just really trying to give this patient the experience that is very encompassing. And like you had mentioned, Alan, you know, it's like you bring your child in there and they're like, okay, they got gums, they look pink and healthy and moving on, right? You know, even though that some of these patients are littles, right? But we can talk to them about the eruption and when to expect that in the age brackets. And, you know, when their first couple teeth pop, you know, let's talk about how you care for them and what we can offer you in dental. And I think seeing the value in that when it's coming from a place of a dental perspective, even though it's being mentioned in that appointment, we're able to elaborate a lot more on it. And I think the providers were, you know, that's not really their jurisdiction, right? You know, having somebody to be able to come in and offer that from that perspective was very valuable.
Yeah, it seems like the approach is one that we see that works effectively for most change management, which is you have your champions, you find those medical providers, they're going to be really excited and engaged, and then work through them to sell to maybe the people that are less, you know, change friendly or less geared towards, you know, adopting new innovative workflows.
Absolutely. Yeah. And that's exactly what it was, you know, really taking those champions, starting with them, and then letting it kind of roll out from there.
Yeah, awesome. Just one other question here is just related to the impact on visits, or like, how do you guys think about if you have a new patient on the dental side? What is the impact of one new patient in terms of visits for a year? Is it really what's kind of your averages, or do you know that off the top of your head?
I don't know the averages off the top of my head. I can speak coming from like a place of getting that new established dental patient. There's almost like a invaluableness to it in a sense, because now we get to see them and treat them and educate them along the way, right? And maybe without getting them into our dental practice and establishing a dental home, who knows what their future would look like without the routine exams and cleanings and x-rays and things like that. So from that perspective, I don't know if I can speak clearly enough from it, but from what I just shared, it's kind of invaluable to us.
Oh, that's great. I thought I would just pull real quick. I wanted to pull some of the survey responses, and we can probably end on this. But just to give an idea for how patients at Connexu have responded to this. So on the tablets, when the patient's alone in the room, once they've wrapped up, we filtered this to only show some of the patients in the last couple of months that had hygiene visits. And just great feedback. You'll see some typos. Great gob. I'm assuming that's job. People are nice, great job, professional, friendly service, very kind and personable nurses, care for others, being fast to attend to needs. One of the fun things that I really enjoy about being connected with Connexu is I get a little summary of these patient responses, these survey responses, and they always make my morning. They're awesome. You guys do a great job with providing excellent patient care.
Yeah, it's fun to see the feedback, and it's very wholesome, to hear that our patients are happy and are having great experiences. And when they identify certain staff members, it's so exciting to be able to share that with them. They deserve to hear, like, hey, you stood out to this patient, and I want you to know that. That's huge. And I will say, just to add on top of that, what this has done for our staff internally has been amazing. Like I had mentioned before, we were in separate locations, and so you have people that have been working for our organization for a long time but have never crossed paths because we were in different locations. And now being under one roof and working together collaboratively, and being able to get to know one another has been amazing. And so not only are our patients thriving from this, our staff is thriving from this too.
Yeah, awesome. Well, thank you so much, Hannah. If everyone wants to give a virtual round of applause for Hannah here. Thank you so much for giving some time and sharing. Looks like Jill figured out a virtual round. There we go. That's great. Feel free, I think, feel free to send anything via the chat. We'll also follow up via email if there's any questions that came as a result of this. Thank you everybody for joining. We will send the recording out via email, and then we'll also include the slides for everybody's information. Thanks, everybody.
Thank you.